Welcome back to the Better Arizona Show, everyone. I'm Sarah Karlstrom. Skin cancer is the most common form of cancer, and it's something we're all vulnerable to living here in the Valley of the Sun. That's why we're here today at Arizona Oncology to find out everything we need to know. All right, I'm here with Dr. Jerry Lucas, and obviously skin cancer, very prevalent in this part of the country. What I want to talk about today is what happens after you're diagnosed.
Well, treatment. And there's a few different ways to treat. Most patients are going to have some type of surgery performed. And that's usually going to be something done in a dermatologist's office or a general surgeon's office. And usually that's going to be excising the skin cancer or freezing it or what we call desiccating it, kind of burning it. But what a lot of people don't know is that radiation treatment is also an option for treating skin cancers, what we would call non-melanoma skin cancers.
Really? And why would someone choose that path as opposed to just having it cut off?
The patients that we will usually see for radiation are going to be someone who may not be an optimal candidate for surgery. Okay, if it's easy to remove a lesion, that's probably the best way. But sometimes if someone's elderly, where they can't tolerate a surgery or there's concerns about having to take them off some critical medication to do a procedure, then we may irradiate it. Sometimes lesions can be in a critical area of the face, like in the corner of the nose or on the nose or an eyelid, where you wouldn't want to necessarily remove that and have to go through a reconstructive surgery.
I know. Will you show me some of the pictures? Some of them kind of hard to look at. You're looking at them right now. And with radiation, that can get rid of the cancer, but you're not getting part of your body cut out, right?
Right. So usually the cosmetic result with radiation is actually very good. It certainly can have a better functional result than surgery if that surgery is going to be removing any significant amount of tissue also.
And I know we're in the room. Is this how you do radiation? Kind of explain to me the process.
Right. So this is a linear accelerator. The type of beam that we usually use is called an electron beam, but radiation is a very simple thing for skin cancer. We're treating usually a very small area. Patients don't feel anything. It takes a couple minutes, but the treatments logistically are going to be once a day, Monday through Friday, maybe a few weeks to upwards of 6 weeks. So that's why surgery can be easier, but radiation certainly has, for the non-melanoma skin cancers, again, probably over a 99% cure rate to it.
Now, if the cancer spreads, then we're talking about chemotherapy, and that's what we're going to talk about right now. Now I'm talking with Dr. Jason Salganic, and you work on the other side of the skin cancer.
Certainly, if things get out of hand, if the tumors have spread, then we get involved with chemotherapy. Now, remember, there's 3 different kinds of skin cancers. There's a squamous skin cancer. Those are the very common ones that are just on the surface of the skin. There's basal cell carcinoma, which is like the basement of the skin, and then melanoma, which comes from the melanocytes. 3 very different kinds of cancers. The first 2 are the non-melanoma type cancers that you heard about earlier, and those are generally treated with surgery and maybe radiation, but melanoma is the more dangerous one. And that's the one that we treat mostly with chemotherapy, particularly if it's spread. Melanoma is treated with immune therapies like interleukin-2, but there's newer stuff that's really very exciting, an anti-CTLA-4, which is using your immune system and boosting it to actually attack the melanoma cells. Really exciting area. There's a new pill that's tailored for your cancer. It will test your cancer cells for a specific mutation called the BRAF. If you're BRAF positive, you can take a pill, which has a wonderful response rates.
A pill. There's so many questions that people have, and they're sitting and watching this. And again, like I mentioned, Arizona Oncology, full spectrum of care. If you want any more information or want to go to any of their locations, you can go to their website at ArizonaOncology.com. The Better Arizona Show will be right back.